talk a little bit about you're primarily working through telehealth.
Mhm.
So talk a little bit about that and how you establish trust for the from the patient standpoint of using telehealth for these very vulnerable personal issues.
I think it actually helps a lot of people. I think that, again, we talk about how we evolve. I remember when people first talked about telehealth, or there'd be these companies out there that offer it, and thinking I was such a skeptic. And what are they? How can you take care of patients without actually seeing them in your office? And that's crazy. And obviously, for me, I recognized it even before COVID. It was something that I was looking to get more involved in even long before COVID as a um, um, being able to provide more access to patients. But I think that people have become more comfortable with video type communication, whether it be with a doctor or just friends. Um, and I think for some people, there is a safety in it. People can be in their own home and be in their own comfort zone and not in a sterile office setting where there's maybe other patients in the room next door or other people in the waiting room or I think that that actually can improve their ability to feel comfortable and open and honest. And, I think about, therapy offices when people would have to sit in a waiting room at a therapy office and think, now, of course, the other people in the waiting room are there for the same reason too. But yet there's that self consciousness of like, what do they think? What do I think? Etc. Well, if you're in your own home and you don't have to worry about what anyone else thinks, nobody else is there. And so
Right.
nobody knows if you're talking to me about your sexual health, if you're talking to me about menopause, if you're talking to me